Hi, Victoria. How you doing today?
Pretty good.
Very good.
Mm-hmm.
How has the anxiety been around the germs?
I still catch myself almost like double touching, like going to touch it and then reeling back. So I'm starting to notice it, but I still have that anxiety. I
When-
still don't want to touch it.
When you pretty much touch anything that you might think has germs on it.
Yeah.
What are some things that you've touched in between the last session and this session that have distressed you?
Well, I had to go to the store,
Mhm.
which is always a nightmare for me because I don't even like touching my credit card because it's been in so many machines and
Mhm.
there's so much dirt and junk that gets in there. And then the counters and all the I keep thinking about the food that's there, and
Okay.
if I pick it up off the shelf, how many people have picked it up with their nasty hands, or kids picked it up with nasty hands and then put it back. And it's like I need to eat, but shopping's a nightmare for me.
So really, in a supermarket, everything can be
Mhm.
containing germs, have germs on it.
Yeah,
And that's
everything
kind of-
does.
Everything does, and that's what you're thinking about as you're walking through and shopping.
Yeah.
We talked about last time exposure and response prevention, right? I explained kind of the general idea of it. You remember that conversation?
Yeah.
I remember I indicated that we might try some experiments right in session to see if we can move kind of forward in treating your kind of your fear and obsession with germs, and really the anxiety it's causing for you. It's like getting in the way of your life.
It is. It really is.
So I was wondering, is there anything in here, in this office, as you look around, that you would look at and think, I don't want to touch that because it could have germs on it?
I'm really not liking the covers on this chair because at least what I'm sitting in now, my clothes are protecting me from the rest of the chair.
Mm-hmm.
But I have no sleeves on, so I don't like touching the armrests and the covers. And
So even thinking about like your arms touching the back of the chair and
I'm not liking it. I really feel like I should probably go wash my arms.
So what would happen if you put your hands right on the arm covers? What would your usual reaction be to that?
To go wash my arms
Yeah.
until I feel like it's gone.
Mhm.
Until all the dirt is gone.
And how long would that take you to be sure that all the...
I mean, something like this, I'd probably be in there for a good 5-10 minutes, just washing.
5-10 minutes?
Just washing.
Yeah. And how many times a day would you end up washing your hands?
Okay, I don't keep track anymore. It makes me upset. How many
It's
times?
it's that many.
Mhm.
Yeah. That is distressing, and I know that this will be uncomfortable, but I would like you to try to, if you can, feel comfortable with it. Put your hands on the arms of the chairs, on the chair. Just yeah. Let's see what I'm doing. Just like,
All right.
and try to stay like that. So tell me what's going through your mind.
I feel the chair and
Mhm.
I don't like it, and I feel almost like I can feel everybody who's ever touched it, and just what have they been doing, and what did they touch before they touched this, and they probably didn't wash their hands before they touched this, and it's just really making me uncomfortable.
Okay, so you're anxious now.
Yeah.
Yeah. Is it tolerable?
Yeah.
Right. So I want you, remember we talked about scaling before, so like 10 being a tremendous amount of anxiety and 1 being hardly any anxiety. Where are you now as you sit here with your hands on
I'm gonna say about 6 or 7.
6 or 7?
Yeah.
All right. Are you feeling an urge to go wash your hands?
Yes. Yes, I am.
Yeah, so this is a 6 or 7. I want you to sit with it for a few seconds. Right?
Okay.
Alright, so process that, that feeling, right? That you're touching everybody that's ever been in the chair. Right? So consider that thought.
Okay.
So what's the ultimate fear? Like, what's going to happen if you don't go wash your hands now?
I'm gonna get sick.
You're going to get sick.
That someone who's been in this chair was sick or touched something gross that can make you sick. And I'm gonna get sick and I'm gonna die. And I don't wanna die.
Do you feel yourself getting sick?
I feel like it's harder to breathe, I guess. Like my chest is kind of...
Is it tight?
Yeah.
You can still breathe, though.
I can breathe.
Okay. So go ahead and lift your hands up, right? And just put them where you normally put them. Well, now that you've touched the chair, I know that.
Now I could still...
Is that any better? Now you're touching the seat of the chair.
But I feel like if I touch my clothes...
That's even worse.
Yeah.
Yeah.
Then I'll have to go home and change my clothes.
All right. So the thought now, if I had to guess, correct me if I'm wrong, is probably like you really would like to wash your hands.
Very much so.
Yeah. And you certainly can at any time, but I'd like you to try to hold out for a little bit. So your hands where they are now, that's better than up here.
I mean, at this point, I feel like they're already contaminated.
So they're at maximum contamination.
Yeah.
So you can't do any more damage by touching the seat.
Yeah, I'm just trying to avoid touching anything else.
All right. So now it's not so much about getting your hands away from the arms, but getting them under the faucet.
Yeah.
So your anxiety was a 6 or 7 before. Where is it now?
I mean, now that you mention it, it is a little better. I want to say about 4.
About a 4?
3, 4.
3, 4?
I mean, I feel better that my arms are all fit. And I'm focusing on breathing. And I mean...
Is it a little easier to breathe now?
A little, yeah.
Oh,
it is. Yeah.
So if you could wash your hands right this second, well, of course you can, but if you did, what would the anxiety move to?
A 1.
A 1.
I mean, it would take a little bit to get to a 1.
A little bit of hand, like
Yeah,
you'd have to wash them.
actually washing,
Mm-hmm.
but then it'll get to a 1. Then I'll feel okay.
All right, so you've moved from, just in a short time, from a 6 or 7 to a 3 or 4 for anxiety.
Mm-hmm.
Well, of course, the goal was 1. Right, so you could say roughly halfway down toward your goal, without washing your hands at all.
Oh, wow. I didn't consider that.
Right. So, are you doing okay? You're holding up okay?
Mm-hmm.
All right. So this is what I want you to do before you go wash your hands. I want to use this moment to give you some ideas for the next few weeks. When you touch something that causes you to feel like the germs are on your hands, chairs, whatever it is, I want you to try progressively to wait more and more time between that event, like when you feel that urge, and when you actually wash your hands.
Okay.
Right? I mean, you have to wash your hands at some point. Right? You're going to wash them at some point. That's normal. I'm asking you to try to delay that.
Okay.
Right? Try to stall and not wash them immediately.
Okay.
Okay. Kind of, eventually I want to get to the point where you can wash them when you choose to. Because right now, like the germs are kind of dictating.
When I wash them.
Right. I mean, the way you're thinking about the germs is really laying down the rules. And I want to give you some more control over it. And so where's the anxiety right now?
I mean, as we keep talking, I feel like it's at 2.
At 2?
I mean, I'd still like to go wash my hands. I would feel better if I did, but I don't feel that, overwhelming anxiety anymore.
And no trouble breathing or
Actually, I haven't even thought about that in a while.
There's still that urge to wash your hands that's there, which is understandable. All right. So, once you go wash your hands now, when you come back, I'll talk about the homework again, right? With your anxiety just a little lower. If you're at 2, you can only really get one level lower, right down to 1. And we'll kind of review that again, and we'll lay down very structured amounts of time between when you touch something and when you wash your hands.
Okay.
All right, so go ahead and take care of that now, and then we'll pick up there with me.
Okay.
Come back.
Thank you.
Thanks.